Did you know the nurse to patient ratio in Ghana? Well, the nurse to patient ratio in Ghana is 1:18. That is, one nurse is entitled to take care of 18 patients at a go. So when you go to the hospital and then a nurse is attending to you, that particular nurse is equally attending to 17 other people at the same moment or the same period to which you are being attended to. So when you go to the hospital, the nurses in Ghana are really being overwhelmed with the work. But regardless their overwhelmness, they do not have any right or any reason to abuse or mishandle you. They do not have to misconduct themselves. The profession is such that discipline and professionalism is one of the core values of the profession. And so regardless of the fact that they are being overwhelmed, they must not misconduct themselves. Now, the information I'm trying to carry across is that when you go to the hospital, take it easy with that nurse. Ideally, the nurse to patient ratio ought to be 1:4. And even in the intensive care unit, in the emergency unit, and then the maternity unit, it ought to be 1:3. So one nurse is entitled to 3 patients at a go. But in Ghana, the situation is triple the number that they ought to attend to at a particular period. And so the nurses are being overwhelmed. They are humans, and the job is such that they ought to put their humanly feeling, their emotional feeling aside and be professional at their very best. So when you go to the hospital, I just want you to understand the situation of that particular nurse. I want you to understand the situation that the hospitals are in currently. So when you go, take it easy with the nurse and then try your best possible to make their work easy. There are certain basic things that you as a patient can do for yourself. There are certain basic things that the nurse can teach you to do and only serve as a monitoring body to you, instead of have to do it from scratch for you. Even in Ghana, they ought to have you have the right to be followed up upon by your nurse a few days later, 5 days a week, some 14 days after you have visited a hospital. They ought to have called to check up on you, to know how you are faring, to know if you are taking the drugs at their right dosages and at the right time. But they are so much overwhelmed that even in Ghana, follow-up is not part of the things that we hear of in the hospital. So that nurse is really being overwhelmed. So the little things you can do, like they instruct you, oh, please move to this particular place. The signages in the hospital are really doing their very best to direct you. But you can equally do your quota. The way you can help that nurse is to make their work easy, so that you both can create an environment for you to heal and for the nurse to help you to equally heal. Take it easy when you go to the hospital. I hope that we've learned something new. See you another time on this channel. Don't forget to subscribe. Bye-bye.